Hi, so today I'm going to be talking about common residency interview questions and how to answer them. The most common question you'll probably be asked in a residency interview is, tell me about yourself. And this question can be very daunting, it's very vague, difficult to really answer in a succinct way. They're really looking for you to tell an overview of your life story and why you're interested in that particular specialty, what your goals are, in a very concise, less than 3-minute talk. So, a good approach to answering this question is to start by talking about where you were raised, any cultural background that you have, if your family is from a different country, if you grew up with different cultural perspectives, could bring that up during that time. Then you can move to your undergrad experience, what you studied in undergrad, what was your major, and what was your earliest influence that led you to this career path. So maybe if you were interested in pediatrics, you spent a lot of time working with kids growing up or in undergrad. If you are going into neurology, maybe you studied neuroscience in undergrad. Talking about the early spark for your interest in your particular specialty is a great thing to highlight so that the story flows well, but you're really targeting it towards the goal that you have. So then you can talk about what drew you to the specialty, medical school, what you were involved in medical school, and how that relates to the specialty. And at the end, you're really leading us down this path of saying, these are the experiences that I had in my childhood, in undergrad, in medical school that have now led me into this specialty. And you can give a very brief one sentence about this is why I really was drawn to this specialty, and then another sentence at the end saying this is what the goals that I have for my future career. For example, I want to be a hospitalist, I want to do global health work, I want to do academic medicine. And then you can end by saying, and I'm looking for a residency with blah, blah, blah qualities that can help me reach these goals. So that's a good framework for how to answer the question about tell me about yourself. A good follow-up question to tell me about yourself is going to be, why this specialty? And I think it's good to prepare an answer to this that doesn't sound cliche. So for example, if you're applying into pediatrics, you don't want to say, I really love working with kids. I think pediatrics is really fun. Those are things that might be true, but it's not going to be a unique answer to you, and it's probably a very tired trope that they hear so frequently. So I would try to think of more specific things that you like about your specialty. So instead of those things for pediatrics, you could say something like you really love the problem-solving aspect of peds, you love the breadth of being able to care for a newborn to an 18-year-old in the next room, you love getting to work on teams and tackle medical and social issues, you really love the problem-solving aspect of the pediatric pathologies and caring for patients who can't tell you what's wrong and looking for subtle clues to make diagnoses. All of those things I think are unique to peds and would be unique to you as well. That would be a better fit for answering than something that's vague. And it's also good to bring up specific examples. So, for example, instead of saying, oh, I really love working with patients and families, you could say, during my clinical rotations, I loved getting to counsel a new mother on the care of her newborn and to care for the mother and her new baby. And so that specific encounter and a specific example is going to go miles longer than an example that is rooted in something vague and is going to make it less memorable and less tangible in influencing the interviewer to see your point of view. Behavioral questions are also very commonly asked on the interview trail, so the most common questions you'll probably get is, tell me about a challenging case. So you want to have some information prepared, similar to a patient presentation that you would give a one-liner. So if someone asks you, tell me about a challenging case you saw. So then you could say, this was a 16-year-old boy with a past medical history of type 1 diabetes who was presenting to the hospital with NDKA. And then go on to talk about the specific aspects of the case that were particularly unique or particularly difficult. So it could be related to working across cultures or across language barriers. You could talk about the challenges of working with a patient who was agitated or a family who was angry with you. And talk about the challenges of patients with multiple comorbidities and managing care very complex patients. I wouldn't focus too much on talking about the nitty-gritty details of the actual patient's pathology and presentation, as you would in a regular presentation, but I would give them the highlights reel so that they understand when you talk about what the challenges were, they'll understand like where you're coming from and what particularly you're trying to say with that. So just give them enough background so that they know what's going on, and then focus more on the challenges that you faced in the case and what you learned from it. Another similar behavioral question that you're going to get is, tell me about a time you made a mistake. So in this case, it's important to talk about a mistake that's genuine and honest, but not something that's going to be very incriminating. So you wouldn't want to talk about the biggest time you messed up, or a time that caused very significant damage to a patient or significant issues with patient care, because that could bring up a lot of red flags. You want to focus on a moment that was a correctable incident, and one where you can talk about the insights that you've learned that have helped you to improve in your future practice. So one example that I can give is that there was a time that I was on a clinical rotation and I missed a lab value that had a very significant impact on the patient's clinical management. And so the way that I corrected this was that I talked, once we had caught the lab abnormality, I talked with my senior resident to talk about the differential for what was going on, and to update the management plan to inform the attending about this issue, and to keep the patient extra day, to contact the subspecialists that are needed to help to manage this, and to inform the patient about any updates to his own patient care. Talking about what changes to the actual plan you're going to do and how you implemented it. And so I think that's a good approach to answering the mistake question. A similar question you'll get is a weakness. And similarly, you want to talk about a weakness that's correctable and isn't going to raise any red flags about your potential to be a good resident. So you also don't want to be too cliche with it. So saying like, I work too hard, or I'm too hardworking is not going to be a good answer, because it's going to be a very tired answer that everyone does, and it comes across very inauthentic, because you're not being honest with a real weakness. That's something that's actually something that can be perceived negatively. You're not owning up to the things that you find challenging. A good example of a weakness is something, again, that you can correct, and that you have specific examples of how you've been trying to correct. So one thing you could bring up is that you are more of a listening type, and you don't tend to speak up, or you're not as extroverted. And then you can talk about how you've put yourself in leadership positions to push you to be more talkative and more extroverted. Another thing you can talk about is aversion to conflict, which can be perceived as a positive or a negative. But I think aversion to conflict, talking about what challenges that has raised, and your challenge with speaking up when you or your patients need you to speak up, and how you've overcome that by being part of leadership positions where you've had to speak up and advocate for other people, to push out of your comfort zone, to confront and to raise concerns and issues that you've seen in your working environment. And then finally, another question that's going to be asked at every interview is, why this program? So you want to do a lot of research before you go to the interview, and you want to talk about specific things that you really loved about the program, and particularly how it aligns with your own goals. So you want to bring it all back to your own CV and the things that you've talked about as your biggest passions and your biggest goals in medicine, and talk about how the program has initiatives to help you reach those goals. So for example, if you're really interested in doing advocacy work, then go on the website and look for any advocacy projects that the program has in place, and bring that up in your interview. I really want to come to this program because they have XYZ advocacy initiatives to help me to grow as a leader in advocacy work for my patients. If you're really interested in doing a subspecialty, or you're interested in particular aspects of a curriculum, medical education, talk about any initiatives that program has for those interests and those needs. The last question that you should be very, very familiar with is, do you have any questions for me? And you want to do your research again to be able to answer this question effectively, because being able to have well thought out questions and questions that can't necessarily just be answered from a website is going to be very crucial to the interviewer perceiving you well, and that you did your research on this program. You're not just asking throwaway questions. You have questions prepared showing your interest in the program. And again, bringing that back to your own interests and goals. If you have a particular circumstance and you're interested in learning more about that, for example, if you are, the example I gave before, if you're interested in advocacy work and you saw that, oh, this program has a community outreach initiative, then you can ask your interviewer, what are the most impactful advocacy projects that people have been involved in this residency? How do residents balance advocacy work with the rigors of their residency curriculum? What are the opportunities in so-and-so program, and what are the experiences that people have had in doing this work? Having those well thought out questions that are rooted in the research that you've already done on the program is going to take you very, very far in the interview. So that's an outline of some of the most common questions you might be asked during a residency interview. It's not comprehensive, but you can talk through more of the scenarios that you might come across, and I think that it'll be really helpful to have you be as prepared as possible for nailing your interviews.